If you're past 60 and regularly swallowing a D3 plus K2 combination pill because you've been told it strengthens bones, protects your heart, and boosts immunity, I need you to stop for just a moment. There's a chance you're inadvertently damaging your kidneys with that very supplement. I know this sounds counterintuitive. After all, these two vitamins have been celebrated across health blogs and medical offices alike as the ideal duo for optimizing calcium balance and building stronger bones. But here's what often gets overlooked. When these vitamins are combined incorrectly or taken without understanding their effects on your system, they can gradually place hidden stress on your kidneys. An increasing number of older adults have experienced unexplained kidney complications after months or even years of taking these combination capsules. The symptoms start quietly. Perhaps you're feeling more exhausted than usual. Your mouth feels dry. You're waking up multiple times during the night to use the bathroom. Or there's just this nagging sense that something internally isn't quite right. Most people attribute these changes to simply getting older. But sometimes the true culprit is sitting right there in your daily pill organizer. So what's the actual connection between vitamin D3, vitamin K2, and kidney harm? The reality is that both vitamins play crucial roles in how your body manages calcium, but the equilibrium is incredibly delicate. When that equilibrium shifts too dramatically, calcium can accumulate in places it shouldn't, particularly within your kidneys. Rather than fortifying your bones, that excess calcium may gradually calcify your blood vessels or create deposits inside the very organs designed to keep your blood purified. I've witnessed this scenario unfold repeatedly with older patients who are genuinely trying to make healthy choices. They learn that D3 enhances calcium absorption and that K2 prevents it from settling in arteries, so they increase their dosage, assuming more equals better. But in biological systems, more is seldom better. What matters is precision, timing, and individual context. What supports one bodily system can easily overwhelm another. Over the next half hour, I'm going to demonstrate exactly how this process unfolds. We'll examine what D3 and K2 actually accomplish in your body, how their relationship can transform from beneficial to harmful, and what current scientific research reveals about using them safely. I'll present actual medical cases that illustrate how vitamin excess can silently compromise your kidneys. And I'll provide you with clear, actionable guidance to protect yourself while still obtaining the advantages these nutrients offer. By the conclusion of this video, you'll recognize the warning signs to monitor, the straightforward tests your physician can order to ensure your levels remain in a healthy range, and the proper method to combine or not combine these supplements based on your age, current medications, and kidney function. Before we proceed, if you haven't subscribed yet, please take a moment to do so and click the like button so you won't miss any of my future health content. Together, we'll ensure your decisions genuinely strengthen your body rather than placing invisible strain on it. To grasp why the D3 and K2 pairing can shift from advantageous to detrimental, we need to examine more closely how vitamin D3 actually operates within your system. When you consume a vitamin D3 supplement, or when your skin synthesizes it from sun exposure, it doesn't immediately become biologically active. The initial conversion occurs in your liver, where it transforms into a compound called 25-hydroxyvitamin D. Consider this the storage phase, then your kidneys assume control. They convert that stored vitamin into its active configuration called 1,25-dihydroxyvitamin D. That's the form your body actually utilizes to regulate calcium, strengthen skeletal structure, and influence hundreds of other cellular functions. In straightforward terms, your skin initiates the process, your liver prepares it, and your kidneys complete it. This means your kidneys aren't merely passive filtration devices. They're active participants in how vitamin D functions. Daily, they help determine how much calcium gets absorbed, how much remains in circulation, and how much exits your body. That's precisely why vitamin D metabolism is so intimately linked to kidney health. Now, Vitamin D3's primary function is to enhance calcium absorption in your intestines. It enables you to extract calcium from your food and transfer it into your bloodstream. It also signals your bones to release calcium when your levels drop too low. In appropriate amounts, this is vital for muscle contraction, nerve signaling, and maintaining skeletal strength. But when vitamin D3 levels climb too high, that equilibrium collapses. You begin absorbing more calcium than your body can safely process. Instead of benefiting your bones, that surplus calcium can circulate through your blood seeking somewhere to settle. And frequently, it winds up where it absolutely shouldn't be. That's where vitamin K2 was intended to intervene. Vitamin K2 functions as the traffic director. It activates specific proteins like matrix GLA protein and osteocalcin that channel calcium into your bones and teeth, while preventing it from accumulating in soft tissues, such as your arteries and kidneys. Without sufficient K2, calcium can't locate its proper destination. It may deposit in your blood vessels, your joints, or even worse, inside your kidneys. Many individuals take K2 alongside D3 precisely for this reason, and when executed properly, it can function beautifully. But if the proportion between them is incorrect, or if your body's metabolism has decelerated with age, that delicate balance can easily tip in the wrong direction. Elevated doses of D3 drive calcium into your bloodstream more rapidly than K2 can regulate it. If you're deficient in K2 or your liver isn't functioning optimally, that excess calcium has nowhere to go. It begins forming deposits, microscopic crystals that your kidneys must now filter. Over time, those crystals can irritate and inflame kidney tissue, resulting in a condition called nephrocalcinosis. This represents the concealed danger of the D3 and K2 synergy. The combination appears flawless in theory, but in practical application, it depends on numerous variables: your dosage, your diet, your hydration status, your age, even your medications. Once calcium concentrations in the blood become excessive, a condition termed hypercalcemia, your kidneys are the first organs to suffer the consequences. The kidneys labor intensively to eliminate excess calcium, but in the process, they become strained. Calcium can settle in the microscopic tubes that transport urine, creating tiny obstructions. Over time, these blockages diminish your kidney's capacity to filter waste effectively. That's when symptoms start emerging: muscle weakness, exhaustion, confusion, and in more severe situations, kidney stones or declining kidney function. The kidneys are extraordinary organs. Each one houses nearly 1 million filtering units called nephrons. Their responsibility is to eliminate toxins, regulate minerals, and maintain electrolyte balance, including sodium, potassium, and magnesium. They depend on a precise flow of blood and filtration pressure to perform their work. When calcium starts accumulating inside them, that precision system becomes disrupted. The filters can become rigid. The small blood vessels can constrict. Fluid balance grows more difficult to maintain. What began as a minor vitamin imbalance can progressively transform into a mechanical dysfunction deep within your kidneys. People beyond 60 are especially susceptible. As we age, kidney function naturally deteriorates. The body becomes less proficient at excreting calcium and balancing electrolytes. Add medications like diuretics or proton pump inhibitors, which are frequently prescribed at this age, and the burden intensifies even further. The kidneys wind up performing double duty, attempting to process supplements while simultaneously managing the side effects of daily prescriptions. That's why even though D3 and K2 are both essential nutrients, the context matters far more than the capsule itself. Your kidneys, not your bones, are the actual regulators of vitamin D's final activation step. When they're compelled to handle excessive calcium or an imbalanced supplement regimen, they pay the price silently at first, and then more noticeably as time progresses. Understanding this foundation helps us comprehend why some individuals develop kidney complications even when they believe they're taking healthy vitamins. It's not about good or bad supplements. It's about how your particular body can handle them. In the following section, we'll examine what transpires when that balance tips too far, and why something as seemingly simple as your diet, hydration habits, or timing can determine the difference between support and strain. Let's examine what occurs when the equilibrium between vitamin D3, K2, and calcium goes awry in actual clinical scenarios. Over recent years, physicians have begun observing an increasing number of patients, particularly older individuals, presenting with indicators of kidney stress or even kidney failure following prolonged high-dose vitamin D3 supplementation. One case documented by Healthline involved a gentleman in his 60s who had been consuming between 8,000 and 12,000 international units of vitamin D daily for several months. He was convinced he was making optimal choices for his skeletal health, but one day he started experiencing unusual fatigue, nausea, and observed that his urinary output had increased. When physicians conducted his blood work, they discovered dangerously elevated calcium levels and severely compromised kidney function. It required weeks of medical intervention and hydration therapy to stabilize his condition, and even afterward, his kidneys never completely recovered their normal function. This isn't an isolated incident. The Mayo Clinic has documented multiple instances of vitamin D toxicity resulting in hypercalcemia, a condition where blood calcium levels rise beyond what the body can regulate. When this occurs, calcium can precipitate from the bloodstream and crystallize inside the kidneys. Over time, these deposits calcify, triggering inflammation and scarring. Some patients require hospitalization for dehydration and electrolyte disturbances, and in severe cases, permanent kidney damage ensues. Most people never suspect vitamins could be the underlying cause. They assume kidney problems stem exclusively from diabetes or hypertension. But when you analyze the pattern, it becomes evident. Excessive vitamin D consumption, particularly without medical oversight, gradually builds calcium overload that the kidneys cannot manage. It doesn't manifest overnight. It develops gradually, one capsule at a time, until the body's filtration system starts breaking down. The early warning indicators are often subtle. You might begin urinating more frequently, especially during nighttime hours. You might experience constant thirst or nausea following meals. Some individuals report bone or muscle discomfort that doesn't quite add up, or an unusual sense of weakness even when their blood glucose and blood pressure appear normal. These are preliminary signals that calcium may be circulating too freely, or that the kidneys are struggling to clear it. When doctors assess these cases, they rely on specific biomarkers to detect what's occurring beneath the surface. Creatinine and blood urea nitrogen, commonly abbreviated as BUN, are two critical markers that reveal how effectively your kidneys are filtering waste. Elevated readings indicate the kidneys are under duress. Blood calcium levels communicate another aspect of the story. When total or ionized calcium exceeds normal parameters, it indicates the regulatory system is imbalanced. Simultaneously, measuring parathyroid hormone, or PTH, helps determine whether the body is compensating appropriately. And when doctors examine both 25-hydroxyvitamin D and 1,2,5-dihydroxyvitamin D, they can determine whether the body is overactivating vitamin D pathways that propel more calcium into circulation. Imaging studies can verify the physical consequences. Ultrasound or CT scans occasionally reveal tiny white spots within kidney tissue, small calcium accumulations that shouldn't exist there. These represent early phases of nephrocalcinosis, and they frequently go undetected until symptoms intensify. By that point, the damage may already be advancing toward fibrosis, where healthy tissue gets replaced by rigid, non-functional scar tissue. So, how does this damage actually transpire? It begins with microscopic calcium deposits forming in the spaces between kidney cells. Each kidney contains millions of small filtering units that depend on unobstructed flow and clean membranes to perform their function. When calcium accumulates along these pathways, it diminishes blood flow and clogs the filters. the delicate electrolyte balance becomes disrupted. As the small vessels constrict and blood perfusion decreases, less oxygen reaches the kidney tissue. This triggers inflammation, which attracts immune cells and further accelerates scarring. The indirect effects compound the problem. Elevated calcium levels can induce dehydration by drawing water into the intestines and increasing urination. As the body loses fluid, the kidneys must work harder to filter concentrated blood, elevating the internal pressure inside those tiny filtering units. It's analogous to operating an engine with insufficient oil. The components begin grinding, heat accumulates, and eventually performance deteriorates. Once sufficient damage accrues, chronic kidney disease can develop. Certain populations face substantially higher risk. Age represents the primary factor. After 60, kidney function naturally declines by approximately 1% annually. This means even minor imbalances can generate a larger impact. Individuals who already have kidney disease, hypertension, or diabetes are particularly vulnerable because their kidneys are already functioning at diminished capacity. Those who take multiple supplements without coordination also confront elevated risk. It's commonplace for someone to take a multivitamin that already contains vitamin D, plus a D3 and K2 combination pill, and perhaps even calcium tablets. The cumulative dose can easily exceed what the body can safely tolerate, especially when taken daily for months. There's also a population with metabolic conditions that modify how their bodies process calcium. Thyroid or parathyroid disorders, for instance, can amplify vitamin D's effects. Certain medications like thiazide diuretics or lithium can elevate calcium levels further. And individuals taking proton pump inhibitors for acid reflux or heartburn may already have compromised magnesium absorption, which indirectly exacerbates calcium imbalance and kidney stress. When you assemble all these elements, the picture crystallizes. It's not that vitamin D3 and K2 are inherently harmful, it's that they're powerful, and when something possesses power, it demands respect and precision. For older adults, particularly those with even mild kidney concerns, this combination requires utilization with awareness, not routine. What commences as a modest daily dose for bone health can, without guidance, transform into a steady drip of stress on the kidneys. In just a moment, we'll explore what you can do to use these supplements safely, how to test your levels, and how to implement small adjustments that protect your kidneys while still supporting your bones and heart. Because as you'll discover, safety isn't about abandoning vitamins. It's about providing your body the conditions to use them wisely. Now that we comprehend how vitamin D3 and K2 can occasionally create complications, let's discuss how to utilize them safely. Because the reality is, both of these nutrients are valuable. They support robust bones, healthy arteries, balanced hormones, and even enhanced immune function. The key isn't to discontinue them out of fear, but to employ them with wisdom and precision. Let's begin with vitamin D3. According to research from the Mayo Clinic and Healthline, the general upper threshold for adults is approximately 4,000 international units daily. For most individuals, that's sufficient to maintain vitamin D levels in the optimal range without elevating calcium excessively. Some people, particularly those residing in northern climates with extended winters or who spend most of their time indoors, may require slightly more. But that should only occur under medical supervision with periodic blood testing. If your physician has measured your 25-hydroxyvitamin D level, that number should ideally remain between 30 and 50 nanograms per milliliter. Exceeding 70 or 80 doesn't make you healthier. It simply increases the probability that calcium will accumulate where it shouldn't. I've encountered patients whose levels climbed above 100 simply because they were taking multiple supplements without recognizing how much overlap existed. Their intentions were admirable, but their bodies paid the cost. Regarding vitamin K2, most studies indicate that a dose between 90 and 120 micrograms daily is adequate for adults. Forms like MK7 are longer lasting and more readily absorbed. You don't require large quantities to obtain the benefit. What matters most is consistency. Taking it daily enables those calcium-regulating proteins to remain activated. If you're using a D3 and K2 combination pill, ensure the ratio is appropriate. Many high-dose products on the market lack proper balance. Some provide 5,000 or 10,000 units of D3, but only a trace amount of K2. That's comparable to turning on the faucet without ensuring the drain is open. The calcium floods in, but has nowhere to go. Seek formulas where K2 is properly proportioned to D3, and remember that quality matters. Third-party testing or products manufactured by reputable medical-grade companies are worth the investment when it concerns your kidneys and heart. There are also situations where it's preferable not to combine them. If you already have kidney disease, elevated blood calcium, or you take medications that affect vitamin K, such as warfarin or other blood thinners, you should not use a D3 and K2 supplement without medical authorization. Even though these are vitamins, they function like hormones in your body and can interfere with medication safety. In such circumstances, your physician may recommend taking D3 alone at a reduced dose or concentrating on dietary sources of K2 rather than supplements. Sometimes it's superior to take them separately depending on your diet and medication schedule. For example, if you already obtain K2 from foods like eggs, cheese, or fermented products, you may not require an additional K2 supplement daily. Conversely, someone who consumes minimal animal fat might benefit from small daily doses. The optimal approach is individualized, not one size fits all. Monitoring your levels represents one of the wisest actions you can take. I advise my patients to check their vitamin D levels at least twice annually, ideally in winter and late summer. Request both 25-hydroxyvitamin D and calcium on your blood panel. Creatinine and BUN should also be evaluated to assess kidney function. If any of those numbers drift upward, that's your body's method of requesting an adjustment. If something feels abnormal, such as persistent thirst, nausea, muscle weakness, or an unusual increase in urination, discontinue the supplement temporarily and consult your physician. In some instances, imaging studies such as an ultrasound or CT scan can detect early calcium deposits before they become serious. Remember, prevention consistently costs less than treatment. For those who prefer a gentler approach, there are excellent natural methods to maintain healthy vitamin D and K levels without relying heavily on pills. Sunlight remains one of the finest sources of vitamin D. Approximately 15 to 20 minutes of midday sun exposure on your arms and face, several times weekly, can maintain your levels stable, especially during spring and summer. During winter months, you can depend on foods like salmon, mackerel, sardines, and fortified dairy products. Vitamin K2 is found naturally in foods like egg yolks, aged cheeses, and a traditional Japanese dish called natto, made from fermented soybeans. Leafy greens like spinach and kale are abundant in vitamin K1, which your body can partially convert to K2. By combining these foods with a balanced diet and adequate hydration, you can provide your body everything it requires without overwhelming your kidneys. And don't overlook hydration. Your kidneys depend on water to flush excess minerals and maintain smooth blood flow. As a general guideline, aim for 6 to 8 cups of water daily, more if you reside in a warm climate or are physically active. If you consume coffee or alcohol, balance each serving with a full glass of water afterward. This simple habit protects your kidneys more than most people realize. The final piece of guidance is to avoid chasing rapid results. Vitamins require time to build their effects. Think in terms of months, not days. When you provide your body steady, moderate support, it responds beautifully. When you overload it, even the best intentions can backfire. In the next and final segment of this discussion, we'll consolidate everything: the practical daily rhythm that helps you maximize your vitamins while keeping your kidneys strong and your energy stable. Because the objective isn't merely to take supplements, but to create a lifestyle where your body and your choices work in harmony. So, let's consolidate all of this. The combination of vitamin D3 and K2, can be extraordinarily beneficial when utilized correctly, but it can also become hazardous when used carelessly, especially concerning your kidneys. These two vitamins are powerful instruments, but like any instrument, they must be handled with respect. Excessive D3 drives calcium into the bloodstream, and without adequate K2 or proper kidney function, that calcium may settle in inappropriate places. Over time, it can generate silent stress on your kidneys, the very organs that activate vitamin D initially. You've witnessed how this unfolds in real-world scenarios. We discussed actual cases of individuals taking high doses of vitamin D, sometimes 8,000 or 12,000 international units daily, and ultimately experiencing calcium overload and kidney injury. We've also explored how simple habits like inconsistent timing, inadequate hydration, or combining multiple supplements can quietly build that stress over time. The mechanism is transparent. When calcium becomes imbalanced, it begins calcifying soft tissue, constricting small blood vessels, and forcing the kidneys to work harder than they should. But the encouraging news is that it's entirely preventable. By following safe dosage guidelines, maintaining your D3 intake under 4,000 international units, unless prescribed otherwise, balancing it with adequate 2,000 kwacha, and obtaining regular blood tests, you can enjoy all the benefits without the risks. If you're over 60 or have any history of kidney complications, speak with your physician before initiating or continuing any supplement. Request tests that measure your calcium, vitamin D, and kidney function. These straightforward steps can protect you from complications before they even commence. I want to emphasize that this isn't fear-based counsel. It's not about avoiding vitamins or distrusting supplements. It's about awareness. The identical nutrients that help you live stronger and longer can also harm you if they're consumed without understanding how your body processes them. That's why it's crucial to view your health as a partnership between you, your physician, and the choices you make daily. So take a moment to review your supplements, examine the labels, and ensure you're not inadvertently doubling up. Maintain your diet rich in whole foods, stay hydrated, and give your kidneys the care they deserve. They've been laboring diligently for you throughout your entire life, filtering more than 50 gallons of blood every single day. A little attention extends a long way. If you found this valuable, share it with someone you care about. These small fragments of knowledge can create a genuine difference in someone's health and quality of life. And if you haven't subscribed yet, do so now so you won't miss my upcoming videos where we continue exploring how food, nutrients, and lifestyle can protect your body from the inside out. Stay safe, stay healthy, and always listen to what your body is communicating to you. It's the finest guide you'll ever have.